we shall read George Bernard Shaw's essay, or Doctor's Men of Science. In the first lecture, we read about why is George Bernard Shaw against doctors. Today, we shall read about what is the difference between a doctor and a quack. In this essay, our doctor's men of science, George Bernard Shaw, G.B. Shaw, compares a qualified doctor with a quack. According to Shaw, the business of the qualified doctor is to sign death certificate officially, while the quack sign death certificate unofficially. It is the business of both type of doctor to kill the patient. चार बर्नार्ड शाह कहते हैं कि there is no a special difference, a great difference between a doctor and a quack. Both the function of both kind of medical practitioner is to sign a death certificate. A qualified doctor signs the death certificate officially, and a quack signs death certificate unofficially. That is the main difference. He signed death certificate officially, and quack signs death certificate unofficially. Just the function of both kind of doctors is to sign death. This is the main difference. Then there is no other difference between the two. Now he tells us about what are qualified doctors. There are qualified and registered doctors. There are two types of doctors. One are registered and qualified, the other are quacks. Other are quacks. There are qualified and registered doctors. They possess adequate knowledge of medical science and human body. The registered and qualified doctors, they have adequate knowledge of medicine and body. As there are two types of classes in our society, the rich and the poor. Similarly, these two kinds of doctors represent two classes. The qualified and registered doctors are consulted by the rich, and quacks are consulted by the poor people. That is the difference. Because rich people consult them, and they know that registered and practitioners and qualified doctors know that only rich people and high class of people consult them. So they rich, they charge very high fee. They fleece them. उनकी चपड़ी उधेड़ते हैं. They fleece the patient and do not treat them properly. They have their eye only on the pocket. They just want to feather their nest and earn money. And the quacks, these are unregistered and unqualified practitioners.
Yes.
Although the registered and qualified doctor have adequate knowledge, the quacks don't have adequate knowledge of medical science. Uneducated, uneducated, illiterate, ignorant, and poor people, less privileged people, consult them only. Consult them only and populate their clinics. The difference is that, as I have told you already, that as there are two classes in society, the rich and poor, similarly, these two classes of medical profession represent them. because the quacks are consulted by only the poor, less privileged strata of society. They too charge very high and earn a lot of money. But relatively, relatively, they charge low than registered and qualified doctors. Now, the question is, how can we define a quack? नीम डॉक्टर अताई जिसको हम कहते हैं, जब कुछ न बन पड़ा तो डॉक्टर बन गए, जब और कुछ न बन पाए तो डॉक्टर। एक मिसाल के तौर पर बच्चों, मैंने उससे पूछा मैंने कि आप क्या करेंगे, उसका क्या, अगर मैट्रिक थी गई तो बात कोई चुका काम करे सू, नहीं तो डॉक्टर बनना। एक ने कहा तो मैं एमबीबीएस बन जाऊंगा। मैट्रिक करने के बाद एमबीबीएस, सप्ली तो बाद एमबीबीएस करे सा, मैं कहा मियाँ बीवी बच्चों समेत बन जाऊंगा। दूसरा मेडिकल वाला एमबीबीएस नहीं, मियाँ बीवी बच्चों समेत वाला एमबीबीएस। अब इस कैटेगरी जो क्वैक्स है उसमें कौन कौन आते हैं? इसमें बच्चों आते हैं बोन सेटर्स, बोन सेटर्स हड्डी जोड़, हड्डियां ठीक करने वाले जट, जी सर, हर्बलिस्ट जड़ी बूटियों के माहिर, द स्पिरिचुअल हीलर्स रूहानी इलाज करने वाले, these people are called quacks. These people are called quacks. In the village, there are witch doctors who sell charms. देहातों में जादू टोने वाले डॉक्टर होते हैं जो तवीज गंडा बेचते हैं। बच्चों, ये ignorance causes the thriving practice of the charmers. ये जो तवीज गंडे वाले हैं ना, इनकी जो प्रैक्टिस जो बढ़ रही है ना, ये हमारी जहालत। बच्चों, मैंने सुना है कि छांग में किसी इलाके में एक बंदा है, वो तावीज देता है कि अगर आप इस तावीज को बिजली के मीटर के साथ बांधेंगे तो आपका बिल कम आएगा। This is the situation of our society. This is the situation of our society. Then there are herbalists, और ये जो जड़ी बूटियां बेचने वाले हैं, सनासी, जिनको हम अपनी वर्नाकुलर लैंग्वेज में कहते हैं, they collect various herbs by wandering through the field. वो खेतों में इधर उधर घूम फिर कर ये कलेक्ट करते हैं, ये जो जड़ी बूटियां हैं, and then they boast, they brag that these herbs work wonders, they have magic qualities, and in this way they cure the certain diseases. They have also a thriving practice, but they don't have scientific approach in the treatment of patients. Even there are some bone setters, even the charmers, even the herbalists earn more than the qualified and registered doctors. Now, what we have read today, according to GB Shah, there is no difference between two categories of medicine, medical profession. Apothecary, they just have the view in their mind to earn money, and practitioners, qualified practitioner, registered practitioner, they have only one point of view, and that is money. Both have the similarity and common agenda to earn money by foul and fair means, by hook or by crook. Both kind of practitioner, they don't have in their mind to cure the ailing humanity. They lack also humanity and they don't concern for humanity in this way. But very humorously, Dr. George Bernard says that both kind of doctor sign death certificate. One has the official license to sign, and the other doesn't have the license. That is the main difference. अगर उसके हाथ बंदा मर जाए ना, तो क्योंकि उसके पास डिग्री होती है, वो एक रजिस्टर्ड होता है, क्वालिफाइड होता है, उसको पूछने वाला कोई नहीं है। चाहे वो जितने बंदे मार दे, चाहे वो निश्तर अस्पताल की मुल्तान की छत के ऊपर लाशों का ढेर लगा दे, there is no one to ask him, there is no one to challenge him. But I think in this regard, uh, very pitiable situation is with the quacks, because everyone can point a finger on the quacks. He has no an official and authorized and authentic license, but both sign the death certificate. That is all. Thank you very much. ये था आज हमारा लेक्चर।